Meshram, Sunil, voice is clear? Okay, so let's start the class. Okay, let's wait 2-3 minutes for other people to join in. Okay, then we'll start, because we are done with endocrine system and we done the questions. Almost 10 MCQs we have covered from the recent. So I discussed first day, second day, so almost 10 MCQs we have discussed. Okay, I will discuss more. Okay, fine. Okay, so we'll start now. Now we are going to discuss the glucocorticoids. Okay, now understand first thing, whenever there is stress, okay, so what happens in the case of stress? Okay, there is hypothalamus releasing the hormone CRH. Okay, what is stress? It is any threat. Stress is what? Any threat to your normal life, that is fever, infection, any injury, not getting the food, exam. So any threat is stress. Example, MCI. Okay, so is MCI threat? Yes. Okay, exams, they all are stress. Okay, so all are stress. Okay, so whenever there is a stress, this stress releases a CRH from the hypothalamus. So this question is asked multiple times in PG exam. Stress acts at what level? Obviously brain na. Stress kahan hoga? Brain mein hoga na. So stress is acting at the brain and brain releases CRH. So what it releases? CRH. CRH will then increase ACTH. Okay, and ACTH will then, so remember, infections, injury, all are stressful. Even pregnancy increases glucocorticoid. Increase corticoids, GCs. Okay. Okay. Now these glucocorticoids are going to inhibit the level of these. This is negative feedback. Negative feedback. And as they inhibit, what happens? Obviously there is going to be a decreased level of ACTH in this. Okay, so that means when stress comes, there is more glucocorticoid, which then decrease the ACTH, and then as the stress decrease, ACTH level and CRH level will also decrease. Okay, so it's a very, very important thing. Okay, so glucocorticoids will also decrease and this will also be reduced up further. Okay, fine. Okay, okay, 1 second. Okay, I'll be back. Okay, so all are back now. Okay, so this is the negative feedback system. Okay, so this is the negative feedback system. Okay, so should I start? Okay, so let's start now. Now what do gluco, and one more thing is ACTH has diurnal rhythm, that is twice a day, 2 times a day. That is 2 times a day. Okay, so it is released 2 times. What? One is morning and evening. Morning 6 to 10 AM, evening 6 to 8 PM. So how to remember? See, when is stress maximum? Morning. Why? Getting up from the bed, है ना, brush करना, ready होना, so stress is high. plus mom come and wakes you up. So maximum stress. Then decrease and rise in evening time. So maximum is morning. Okay. So therefore morning highest peak then. So if they give this exam question, how will they give? They'll give like this, okay? Like 2 a.m., 4 a.m., 6 a.m., 10 a.m., 8 a.m. This is PM, okay? Then 12, then 2, 4 p.m., then 6, 8 p.m. So they give you like this, okay? Which hormone is depicted in the graph below. So obviously if a hormone is in 6 to 10 a.m. morning and 6 to 8 p.m. evening, it is most likely ACTH. So which hormone is this? It is a ACTH. Clear? Okay, ACTH. Okay. Now let's start the actions of glucocorticoids, right? So glucocorticoids action. What they do is they fight stress. They fight stress. They fight stress. Okay. So how do they fight stress? Okay. So first is in stress you need to have what? Increase fight flight response. So what they do? Basically they improve fight flight response. How? I'll explain. So what do they improve? They improve the fight or flight response. Okay. So that is how they prepare the body for the flight. Like example, when you go to jungle, okay, that is stress time. Jungle is stress. Tiger come is the danger. Now you need to run. So when should you run? When you enter a jungle or when tiger come? So obviously when tiger come, na. So therefore you need high glucose when tiger come or before tiger come. Obviously when the tiger come or before na. So same way, if you wait for glucose to increase when tiger come, what happen? It will be delayed. Like when should you load bullets in your gun? When the tiger come or already loaded? You need to fire when the tiger come, but bullet should be already loaded. Same way, glucose should be already present. We will consume when the tiger come. So same way, it will increase the glucose level, increase the sympathetic response. How? So let me say, first is it causes hyperglycemia. How? We all know, by glycogenolysis. Okay, and gluconeogenesis. And gluconeogenesis is by lipolysis and proteolysis. Okay, so lipolysis and proteolysis. Are you clear? So lipolysis and proteolysis. Now what is proteolysis done from? It is basically skeletal muscles. Okay, example, which muscle? So it causes muscle wasting. Muscle wasting. Also it causes what? It causes what? Yes, thin skin. And this skin can sometimes show rupture or stretch mark, and it can show stria. Okay, so that is why it can show stria. So stria, they are stretch marks due to stretch. So when pregnancy occurs, the skin get what? Stretch, and can create what? The stria. So therefore stria are stretch marks. Okay, but the reason skin is very thin and bones become weak, so osteoporosis. Why? Because of the bone destruction. Are you clear? So what is causing bone and what is breaking lipid, carb and proteins to make glucose? Answer is glucocorticoid. And what is the function of glucose? It helps. So that is why it can also worsen diabetes. Worsen or cause diabetes mellitus. MCQ. So which hormone can cause diabetes? I told you all except insulin. Okay, fine. Number 2. It also is similar to what? Aldosterone. Remember aldosterone, corticosterone. So that's why it has action similar to mineralocorticoid action. So therefore cause salt and water retention. Salt and water retention. And that sometimes can cause edema on the face. So it can cause sometimes facial edema. and it become moon shape phase. चंद्रमुखी बन जाता है ये, ठीक है, moon shape phase, also called as lunar phases. Okay, so it become moon shape phase. Very common feature. Remember, whenever there is a salt and water retention, the edema is mainly facial. Okay, fine. Number 3, it increases beta adrenergic receptors which cause increase catecholamine sympathetic actions. So without the beta receptor, so that is, by example, increase heart rate, increase BP, increase reflexes, etc. So they all are possible because glucocorticoid increase the sympathetic response. Are you clear? They increase the sympathetic response. Are you clear? Increase. And number 4, they are going to also do what? They will anti-inflammatory, anti-allergic. So they are very commonly used for treatment of what? Autoimmune disease. So the drug of choice of all these inflammatory or autoimmune diseases, answer is steroid, anti-allergic and slow wound healing. Slow wound healing. Okay, clear? They are not similar to hyperthyroid because hyperthyroid increase BMR also occur. Here they are not increasing BMR, they are just increasing the body's capability for a fight or flight response. Are you clear? So they are not having high heart rate, BP, etc. Once there is a increased sympathetic, then there is a increased heart rate, BP. Are you clear? So they are like what? Preparatory hormone. They prepare body for fight or flight. Okay. So which hormone increase the glucose, increase receptor in anticipation of fight flight? Answer is glucocorticoid. And then they are going to act. Which one? Catecholamine. So who increase the receptors? Glucocorticoids. And who will do fight flight? Epinephrine, norepinephrine. Are you clear? Thyroid increase the catecholamine action from the beginning itself. Okay, so don't worry. Okay, chalo. So they're anti-inflammatory, anti-allergic. Which one? Steroid. So that is why steroids are given in almost all hypersensitivity responses, all except few. Okay, like in case of this. Number 5, they decrease bell. They decrease bell and increase other blood cells. Increase other blood cells. Okay. Now, what is bell? Bell is basophil and eosinophil. And remember, they both are causing allergy. So they are for allergic conditions. By releasing histamine. So release of histamine. Okay, basophil, eosinophil, and also lymphocytes. Also lymphocytes. Okay, and they will increase all other blood cells. They will increase all other blood cells. Okay, so what are these other blood cells? So let me write down. So they increase which one? RBCs. That's why they cause polycythemia. Okay, so cheeks become very red because of polycythemia. Okay, and can cause purple stria because of this. Okay, so polycythemia I'll discuss later. Then there is what? Increase platelets, so that clots will form and prevent the blood loss, and increase neutrophils and increase monocytes for phagocytosis. Monocytes. What they both do? Phagocytosis of bacteria. So these are the functions of the glucocorticoids. Okay. Now, if there is decreased glucocorticoid and also aldosterone, there is Addison disease. Okay. So Addison disease is the reverse of Cushing's. You can remember. So decreased glucocorticoids is Addison's disease. What is the reason? Main reason is adrenal insufficiency, because of lack of you can say enzyme etc. So also called as adrenal insufficiency. Okay, clear? So I'll discuss it later in kidney, not now. And increased glucocorticoids is what? It is basically Cushing's disease and syndrome. Okay, see, syndrome is anything which is causing increased glucocorticoids. Okay, reason most common if they say is exogenous steroids. So most common is exogenous steroids. Okay, and also if they ask what are the natural one, primary cause, so that is basically we giving steroid. Okay, and it could be caused by what? Also by congenital adrenal hyperplasia. CH. Okay, so CH is what? Hyperplasia. So there is increased glucocorticoids. Okay, so what smart people do, they will remember Cushing's, and when they reverse the Cushing, you get what? The Addison's disease and syndrome. Okay, so Addison disease is adrenal insufficiency, we are seeing this. Okay, fine. Okay, so in Cushing's what will happen? So first is there is high blood glucose, there is increased blood glucose, hyperglycemia is there, hyperglycemia. So that is why it has diabetes like feature, so hyperglycemia is there. Okay, then there is facial edema. Okay, moon shaped faces. Why? Because of salt and water. Okay, then because of muscle wasting, the limbs become very thin, so they become stick like limbs. Stick like limbs due to muscle wasting, then skin is so thin it easily stretches and bruises. So skin is very thin, stria occur. Stria can be white or they can be red or purple. Okay, so stria. Okay, I hope it's clear. Okay, fine. So gluco help in immunity at low dose. At high dose they become, yes, they impair the immune and inflammatory response. At low dose they help immunity. Okay, Sukanta. Okay, so white and purple. Okay, so skin is thin, stria occur. Okay, number 5, all the fat from the body is broken and deposited. So there is a redistribution of fat. Okay, so fat accumulate in 2 area. One is back of neck, or also you can say abdomen, because these 2 areas have more space. So remember, it has lots of space. Okay, and it has lots, so it is called as camel hump or buffalo hump. Camel or buffalo hump, this back of neck. Okay, and abdomen is causing obesity, pendular or centripetal obesity. So pendular or centripetal obesity is there. Okay, so therefore it give a classical which appearance? Lemon on stick appearance. Lemon on stick, dandiyon pe tinga hua nibu. So what stick? Hands are stick like, so lemon on. So this is lemon. Can you see? These are stria, white stria, and the purple stria. We have purple, yes, and the purple stria. These are stria. Okay, so these are stria. Okay, this is the face of person. You can see it is almost very round like a moon. Okay, also redness is there because of polycythemia. Okay, then hands are like sticks, as if you have taken a lemon and inserted sticks into this. So lemon on stick. Are you clear? So lemon on stick. Okay, so they are very thin limbs. Okay, call as what? This. Okay, clear? Then bones are weak, so osteoporosis. Okay, this is the obesity stria. Then this is the moon face. Chandramukhi ban gaya bhai, chand ka mukhda, Chandramukhi. Okay, clear? So all these are features of what condition? The Cushing's syndrome and also disease if the gland is involved. So this is the case. Are you clear? So we'll remember this. Okay, so Cushing's, all these features you should remember always. Okay, sahi hai? So let me show you the picture. So you will remember it always. Okay, so remember क्या है? ये इसका abdomen, lemon, याद है पीला पीला नींबू. So lemon. और कैसे हैं इसके हाथ पैर? बिल्कुल स्टिक जैसे. It's a very clear cut picture. You will not forget this ever. And the face is almost swollen like a circle, and there's red cheeks. Why? Because of polycythemia RBC. Okay, so let me show this picture. Yes. So can you see? First, there is moon face. There is moon face with red cheeks. Why? Because of what? Apple red cheek. Okay, so apple red cheeks. People say apple red. So apple cheeks. Why? Because of increased RBC. Then there is buffalo hump. Can you see this buffalo hump? So this is the fat pad or buffalo hump or camel hump. Okay, clear? Then bruisability, ecchymosis are because of what? The skin is very fragile. So skin is very thin and fragile. It easily make bruises. So when you give a slight, even you can say a stretch or you can do a scratch, it will rupture. Called what? Bruises. So called as bruises. So skin is thin, bruises occur. Okay, clear? Fine. Then very thin skin, I told you already. So thin skin you can hold. BP is high. Why? Because of high sodium. Okay, so clear? So sodium retention causes high. Okay, so high BP. Why? Because of increased sodium. And edema is also because of what? Increased sodium. And this. Okay, then red stria. Okay, I know the diagram is poor. Pendular. Can you see the abdomen? Very big abdomen. So it's very big abdomen. Pendulous or pendular. Then there are stria because of stretch mark. Can you see in pregnant also? So red stria, striations or stria, striations. Okay, so red striations. And yes, very thin limbs. Can you see? Thin arm and legs. Okay, and poor wound healing. Why? Because glucocorticoids impair the wound. And osteoporosis. I've discussed all the features. Okay, osteoporosis. Okay, clear? So you can just take a photo and you will remember it always. Okay, so I am showing more images now, as you can see. Okay, earlier if you attended my classes, I was doing less clinical and only physio part. Now I am doing more and more clinical with images. So what is the new change in the physio classes? Clinical cases and a clinical scenario plus images. So that would be the pattern for this, so that these classes will prepare you for medicine later on. Okay, so I hope you all got the idea ki what we are trying to learn here. That is the full summary. Okay, so let's revise it very fast. Okay, so what are the features of the Cushing's? Okay, moon shaped face. Clear? Moon shaped face with red cheeks. Okay, buffalo hump, very big abdomen, so lemon like. Hands are very thin because of muscle wasting. Called as what? Stick. So lemon on stick. Dandiyo pe tinga hua nibu, lemon on stick, so stick. Okay, then stria in the abdomen, called as what? Striation, stria. Okay, then there is what? Swelling is there. Then what happens? Yes, there is osteoporosis. Skin is very thin, so it can easily be what? Damage, causing stria formation, this causing bruises, and also osteoporosis. So they are all. And hypertension, hyperglycemia, hypertension because of increased sodium. So high BP, high glucose. Okay, done. Chalo. So we have finished endocrine. Okay, and we have solved almost 10 MCQs, and I'm very much sure that in December exam also you will get 10 to 15 MCQs from endocrine. Which one? Not physiology, applied endocrine. So nowadays the only word is what? Clinical. Okay, chalo. So let's move further. Okay, now we discuss the important concepts in the respiration. Again what? Yes, respiration, physiology plus medicine combined. So I need your help so that you are able to understand this topic very well and also use it for your further study. So I hope it's clear. Okay, so I will start the discussion. Okay, first is, in the case of respiration, what do we see or what do we have? So let's start now. Okay, first, in respiration you should understand first there is a law called as Boyle's law. Okay, is basically pressure volume relationship. It's a pressure is inverse to volume. That is called as the Boyle's law, that pressure volume are inverse. How? Let me show. Let's say we have a balloon, this, okay. Now in this balloon there are what? Let's say gas molecules. So these are the gas molecules. So it has a pressure and it has a volume, okay. If I squeeze it, the molecules come closer, so volume decrease. So if I press a balloon, the molecule come closer, so pressure will what? Increase, because the molecules will fight and collide more, but the volume will decrease. So that is why if you squeeze any structure, any stuff, like I squeeze this, it becomes tighter and tighter. Clear? So when you increase the force, the pressure will rise and the volume will decrease, okay. And vice versa, if I make it bigger, what happens? The molecules spread out. As molecules spread, they occupy more volume, so increase volume, but that causes a decrease in pressure. So that is why increase volume cause a decrease in pressure. That is called which law? Boyle's law, okay. Now we see second thing, that is Weibull airway classification. So Weibull's airway classification, again a very important topic, which is that is the Weibull's airway classification, okay. Now what is the funda? So understand. First is there are 23 generations. Okay, based on division. Based on division, okay, based on the division. Are you clear? And what is the case? So first learn the basics. Trachea give bronchi, bronchi give bronchioles, okay, and bronchioles then give alveolar ducts, and then in the end we have alveoli. So please first let's learn it. So trachea gives what? It gives bronchi. Trachea give bronchi, right and left bronchi, okay, bronchus, okay. Then they give bronchioles, okay, and the bronchioles give ducts and then alveoli. So let's do it again, okay. So trachea, bronchi, bronchiole, ducts, alveoli. Trachea, bronchi, bronchioles, ducts, alveoli. So who's the last one? Alveoli is last one. So trachea is therefore generation 0. He is the papa. He is the papa. So 0. And bronchi become generation 1 first. Clear? So who's the 0? Trachea. And he give 2 bronchi. So this is the 2. Okay. Right and left. Okay. Right and left. Okay. So trachea dividing into 2. Right and left. Are you clear? So trachea. Okay. Second is, now what about the alveoli, etc.? So remember, alveoli is last, it is generation 23rd. Okay, generation 23rd. Okay, and there is something called as what? Acinus. Okay, so from the respiratory bronchiole we start the alveolar ducts and they give the alveoli. So this ducts and all the alveoli, it is connected to. This is called as what? Acinus. Okay, so this is the alveoli, this is the duct. Okay, so this is the case, okay, and this give then respiratory bronchiole. Okay, so the duct, okay, bronchiole, and this is the alveoli. Okay, so just label bronchioles, duct, alveoli. Okay, so bronchiole and at the duct then end up at the alveoli. So this system is called as acinus. Okay, so what is the acinus made from? It is basically alveoli, a duct supplying all, and the duct which is then continuing to the bronchiole. Okay, so this is called as what? This is called as the acinus. Okay, fine. Now what about the bronchiole? So there are multiple bronchiole, primary, secondary, tertiary, but remember the main, there are 2. One is terminal and respiratory. So here which bronchiole is this? Respiratory bronchiole. Now are you clear? So respiratory bronchiole is the starting point for sinus. So they ask you sinus start from, answer is respiratory bronchiole. So let's start now. First is terminal bronchiole is generation 16 and it is generation 17th onward. Okay. So 17, 18, 19 and this is generation 20, 21, 22. But you don't remember them, you can ignore. So I'll just cut them with the pen, ignore. Just remember the ones I'm highlighting, okay? So remember generation 0, 16, 17, 23 alveoli. That's it. So 0 trachea, 16 terminal, 17 respiratory start and 23rd is alveoli. Are you clear? So first question is, if they ask you, there is a very important question that you should remember always and always. So what is the question? So question is like this, okay? So start. Okay. So the question is about the exchange zone. So it is, yes, it is respiratory bronchioles, the gas exchange start. Gas exchange start. Okay. 2 alveoli, maximum exchange. Okay. So it is from which generation? Generation 17 to 23rd. MCQ. So generation 17 to 23rd is called as our exchange zone. So what is it called as? It is called as the exchange zone. 17 to 23rd. 17 to 23rd. Okay. So what is only the conducting zone? Conducting zone. It is no exchange, only transfer the air. Okay. So how to remember this? See, you become a doctor and you exchange medical knowledge till which age? From 17 you enter medical college, okay, or whatever university, and then 23 you get the degree, diploma, whatever, okay. So that is why 17 to 23rd is what? It is the exchange zone. It is the exchange zone, okay. Now conducting zone is no exchange, only transfer of air, and it is from trachea to terminal bronchiole. So trachea to terminal bronchiole is called as what? The conducting zone. Called as what thing? The conducting zone. I hope it's clear. So what generation? 0 to 16. So 0 to 16. Trachea has maximum resistance and terminal bronchiole is what? Terminal bronchiole regulate airway resistance. How? Due to maximum smooth muscles. So what contain the highest smooth muscle? Terminal bronchiole. So if they contract, they squeeze the lumen and less air will go. If they relax, more. So that's why what they can do? They can contract or they can relax. If they contract, that is called as bronchoconstriction. And if they relax, that is bronchodilation. So what happens? More air goes and here less come. So that's why it's like a door. You can, let's say there's a door. So what you can do? You can either make the door very narrow by closing, or you can make it very wide so that more air can come. So that's why they decide how much air will come less or more. Which one? The terminal bronchioles. So what is their physiological importance? Like example, during fight flight, when you're running, remember sympathetic, you want more air, so you want to dilate the airway. Example, exercise, okay, or fight or flight, you want more air. So that is why sympathetic beta 2 receptor cause bronchodilation. It causes the bronchodilation. Okay. Example, we all know salbutamol, salmeterol. So that is why beta 2 cause bronchodilation. They cause bronchodilation. And what is the example? We have beta 2 agonist. Beta 2 agonist, like, yes, which one? Salbutamol, salmeterol, terbutaline. Okay, so these are the beta 2 agonists. Okay, so what they do? They do bronchodilation. They do bronchodilation. Okay, so that is the case. Whereas constriction is caused by parasympathetic. Parasympathetic, which is the M3 receptor. M3, and by histamine, H1 receptor. Okay, H1 receptor. So histamine, H1. So now I'm going to come to a clinical point. You have to understand, otherwise you'll all keep making the problem here. Okay, so once again, bronchoconstriction by parasympathetic and histamine, dilation by beta 2. This is a clinical important point and you have to remember it always and always. Okay, so let me start the story. Okay, story is any person having any obstruction, what need to be done? We need to give a bronchodilator. Okay, so bronchodilator can be of three types. Okay, one is beta 2 agonist, which I have discussed already, or the one which block the histamine release, like sodium chromoglycate. I'll tell you. Okay, so first let me start with a very basic thing. Okay, there is a condition called as bronchial asthma. So in asthma there is a allergen antigen. It bind IgE on mast cell. Okay, mast cell. Okay, also eosinophil is there. And what they do? Then they release histamine. Also leukotriene 4, etc. They are slow reacting, and this then cause bronchoconstriction. Are you clear? So this is type 1 hypersensitivity. Type 1 hypersensitivity. Okay. So this is the bronchoconstriction. Now this bronchoconstriction cause what? It cause difficult breathing. So it cause difficult breathing. Mainly in expiration. So which period? Expiration. And also cause sound called as wheezing. So what is wheezing? It's like a whistling sound, like so it causes a whistling sound. So very, very fine musical whistling sounds called as wheezing. So this wheezing is heard. That is the case. So that's why asthmatic patient, they will have difficulty breathing, they will feel chest tightness, they are not able to expire, and this difficult breathing, dyspnea, what is the most characteristic find? That there is wheezing sound. That is a marker of what? The patient is having asthma attack. Are you clear now? So asthma attack is there. So that is why as doctors, what we can do? So we can treat this by which? So first, since it is hypersensitivity, for treatment, what we can do? So one is we can give steroids. Why? To decrease the inflammation. Yes or no? So we can do steroids. Okay. Then there is bronchoconstriction. So that's why what you can do? We can give beta 2 agonist. Okay. And M3 blocker. That is ipratropium, tiotropium. ipratropium, tiotropium. Okay, so ipratropium, tiotropium. Okay, clear? So they are given. Okay, then histamine and this. So leukotriene you can block by what? Montelukast, zifilukast. Okay, and histamine you can stabilize from mast cell. You can stabilize using what substance? We can stabilize using what substance? I'll use the using sodium chromoglycate. Okay, so sodium chromoglycate stabilize the mast cell. So mast cell is inhibited. Okay, Montelukast is basically for what? Leukotriene 4. Okay, for dilatation we can give beta 2 agonist, the salbutamol, salmeterol, and for M3 is ipratropium, which will again cause bronchodilation. So they are dilators, they are bronchodilators. This is anti-inflammatory. This is, yes, leukotriene 4 antagonist, this one Montelukast, and the sodium chromoglycate is for this. Okay, also for dilation we can use theophylline. It relax smooth muscle via cyclic AMP. Okay, so what they all do? Relax smooth muscle. So this single diagram cover entire asthma features and treatment. So take a screenshot and please save it with you. Okay, the guidelines, the latest GINA guidelines I'll discuss in medicine part. Okay, that how do you manage the asthmas. Okay, but right now please remember this. Asthma is caused by what? Antigen bind IgE on mast cell, eosinophil, release histamine, which cause bronchoconstriction, difficult breathing, expiration, mainly wheezing is there. Okay, treatment we give beta 2 agonist, M3 blocker, ipratropium is the name, theophylline. Okay, theophylline is separate drug. Okay, so the 3 drug we give for dilation: agonist, this and this. So 3 drugs. Okay, then what drug we use for this? Montelukast for leukotriene 4. For this it is 5th drug, which is blocking the histamine release from mast cell, called sodium chromoglycate. Okay, and finally steroids are for inflammatory response. They decrease the hypersensitivity. Okay, clear? Also there are, yes, other drugs also which we can use. Indrajit as told you. Okay, yes, Zilutin. Okay, also there is what we can give this monoclonal antibody omalizumab. Okay, so again, if you want to know this so much now. So it's the monoclonal antibody also which can be used. Okay, Zilutin can also be used. Okay, so that's why if you go in detail, then the information will keep. There are other drugs, okay, which can be used. Okay, so I hope you are able to now remember this physiopathopharma in one. Okay, physiopatho-pharma medicine all combined in one. Okay, fine. Chalo. Now we'll discuss the pressure changes in the respiratory system. Okay, so pressure changes. Okay, clear? So leukotrienes are made by what? It is made by an enzyme called as lipooxygenase. Okay, so this is inhibited by Zilutan. Okay, so LOX inhibition. Okay. Now we will see the pressures. Okay, so respiratory pressures. Okay, topic is and one question came from there. Which topic? Pneumothorax. So if you remember, pneumothorax question was there in the exam. Yes or no? So pneumothorax question. Okay. Okay. So let's start. Okay. So first is what are the system pressure? Okay. So this is a lung, this is the airway, and the alveoli. Okay. And first question. Okay. This is the airway, and this is the alveolar of pulmonary cavity. So alveolar or pulmonary cavity. Okay, so first question, what is outside? So this is atmosphere, this is atmosphere. What is the pressure? 760 mmHg. So now what happens, since the airway are connected to our lungs, alveoli, the pressure in the lung is also same, and this is called as IAP. What is IAP? Intra alveolar pressure, some book use the word intrapulmonary pressure. Both are same, intrapulmonary pressure. So intrapulmonary or intra-alveolar pressure. Okay, so this is IAP and this. Okay, now look at this glass. Okay, so this glass is empty, so it's an open cavity. Why open? It is connected to atmosphere, whereas this bottle mouth is closed, so therefore it is a closed cavity. So there are two kind of cavities, open and closed cavity. So open and closed cavities. Are you clear? Now if the airway are open all the time, so remember airway are always open, always open. Okay, example, trachea, bronchi due to cartilage. Example is trachea and bronchi due to the cartilage. So let me give an example, please understand. Okay, see, you can feel there is what, cartilage, okay, in the trachea, even bronchi, and they prevent it from collapse. So what does it do? It prevent from collapse. So my question is very simple. Okay, without cartilage the airway will remain open or closed? They will close because of collapse. So what happened? You are wishing someone good morning sir, as you tilt your head downward, okay, and the neck is then flex. What happened? The airway will close and you will die, है and then you will be permanently goodbye. Or if you are sleeping or sleeping with someone, means your friend, okay, and during the sleep they hug you, and they put the hand around your neck and you will die because of pressure. So that is why trachea and bronchi never collapse, because of what? Cartilage. Otherwise you will die within a second. So esophagus is always collapse. Esophagus is always collapse. But what is not collapse? Trachea, bronchi. Trachea and bronchi. वरना तो काम हो जाता हमारा. ठीक है, चलो. Now as a result, pulmonary cavity act as open cavity. Act as open cavity connected to atmosphere. Connected to atmosphere. Okay, hence the pressure, hence IAP is always same as atmospheric pressure at rest. Easy? So why is it same? The answer is very easy, because of a very simple fact, because it is connected to the atmosphere. Okay, so because it is connected to what? Atmosphere, it is always same. So what is the IAP at rest? 760. So is it more or less? No, it is same. So remember, same as atmospheric pressure. Okay, same. So the important topics, they were asked recently in the exam, not this one, but previously they asked, especially NEET PG. And remember, NEET PG questions were already getting clinical, but this time they became too much clinical. That was again a problem. Okay, we don't fear clinical questions. We all are doctors and we are supposed to treat patients. Okay, only thing is they should ask questions which are simpler to understand. Why? Because of time constraint plus other factors. Okay, otherwise if ample time, ample training, ample exposure and full blueprint, किसी की औकात नहीं है हम लोगों को पढ़ के मेहनत करके पास होने से रोक ले. आर यू क्लियर? हमें किसी की भीख नहीं चाहिए, हमें किसी की वो नहीं चाहिए सिफारिश. वी कैन ऑल work hard and pass any possible exam. It is only because of what? All these misgovernment issues, mismanagement, that we are facing problems and trouble. Are you clear? Otherwise we all want to work hard, we all want to learn proper clinical, you can say, scenarios and solve the question. Okay, and we should get a proper answer key with explanation ki why this answer is having other answer or why am I right or wrong. Okay, because that is what we are putting. So that mail we are writing to NB contain all the demands. Okay, there are 9 demands we are already writing, so 9 demands, and we will mail them. Already we have talked to them verbally, but again better we also send email, and if they don't work then we will use legal measures to do this. But point is that we are working hard to get all concessions from NB, also MCI at all possible levels. Okay, So that's why you people please keep studying. We are working hard and we will solve the issue as soon as possible. Okay, chalo. Now let's start once again. Okay, so question is what are the IAP changes during the respiration? Okay, so write one more thing. So what is the IAP? Okay, so IAP changes during respiration. So let's start. First is at rest. I told you the same as atmosphere, 760 mmHg. Now since it is same, we can also write it at 0 mmHg. Why 0? Same as atmosphere, no difference. It means same as atmosphere. So what is 0 means? 0 means same as atmosphere. Okay, so what is the IAP at rest? Answer is 0. Okay, now as I told you, what will happen to this during the respiration, that is inspiration and expiration. Okay, so let me explain what happens. In inspiration, the pressure is going to what? Change. So what happens? Let me write inspiration. Okay, so during inspiration, it falls. Why? Because of expansion of the lungs. What happens? There is expansion of thorax and lungs. So there is a fall in the IAP. So there is a fall in IAP. So what happens? So there is fall in IAP and becomes what? Less than 0. Becomes negative. How? I'll show. It is 760, now it becomes 759, that is minus 1 mmHg. So it is not negative as such, it is just 1 less than atmosphere. So it is minus 1 means below atmosphere. It means 1 below atmosphere. It means 1 below atmosphere. Okay, so it becomes negative. Okay, so let me show. This is a lung. Okay, now as it is expanded, the pressure becomes 759. Are you clear? So it becomes 759. Now what will happen? If the pressure is low, what happen? Air go from high to low, low to high. Answer is high to low. So now pressure is 759 in the lung, atmosphere 760. So where will air go? So therefore what happens? It pull air inside lungs. It pull air inside lung. So therefore the air would come inside the lung, and as the air come inside the lung, the pressure will rise. Okay, and what happens? Till pressure is not equal, till IAP 0 again, and then inspiration stop because there is no pressure change. Inspiration stopped. Easy. So how do you people inspire? Very easy. You Boyle's law. As the chest expand, pressure fall. Which law? Boyle's law. Remember? So as you people expand the thorax, the size increase, pressure fall. Size increase, pressure fall. Okay. And as pressure fall, it become below atmosphere. 760. No, it becomes 759. So what happens? The air is pulled inside the lung, and as air is pulled, inspiration occur. So what are the value at the end of the inspiration? So write number 3. End of inspiration, it is back to 0 or 760 mmHg. Easy. So it is back to the 0 or 760. Easy. So back to 0 or 760. Number 4, during expiration. What happens? So let's see. So during expiration, the lungs remain stretched? No, they will return back because of rubber-like recoil. So what happens? The lungs recoil and they will compress the air by Boyle's law. So pressure rises +1, that is 761 mmHg. So what happens? Lungs recoil inwards and compress air inside. Okay. Okay. So lungs recoil inwards and compress air inside. Okay. Clear? And increase IAP. Becomes positive. Let me show the diagram. Okay. So it becomes positive. How? This is the lung. Now it is recoiling like a rubber band. So what happens when you leave a rubber band? You stretch a rubber band. Let's say the rubber band. Okay. So if I stretch, it become longer. Yes or no? But when I leave, it will come back. So see, right now it is getting what? Stretch. It is getting stretch. But when I leave, as it goes back, it will, yes, compress the air inside. So pressure becomes 761. And now that will push air out. So this will push air out till IAP 0 again. Easy. So this will make the IAP 0 again. Make the IAP 0. So that means what is the IAP at the end? So at end of expiration, it is 0 mmHg or 760. Easy. So it is 0 or 760. So at the end it is 0 or 760. Okay. So let's do a rapid recap. Okay. And you will be able to remember it permanently. So just remember, this is your lung. It is 0 right now. Okay. It is 0 at rest. Okay. So rest. Then as the chest expand, what happens? So first step, second. So during inspiration, as the chest expand, the pressure become -1. So it become -1. And that is why air comes inside. Air pulled. Easy. So air is pulled inside. Easy. Then in expiration, the lung will recoil. Okay. And as the lung recoil, they will compress the air. So pressure become +1. Why? Because the, yes, recoil, compress air. So pressure become +1. So air would be pushed out. So that is why the air would be pushed out. So just remember this one. So what is the value at rest? It is 0. Inspiration -1. Expiration +1. At rest 0. Inspiration -1. Expiration +1. Okay. And remember, one is factual. They will ask the fact +1 -1. But they will also be asking you the pressure changes, how they correlate with flow volume curve, how they correlate with PFT. PFT is used for diagnosis of the diseases, restrictive, obstructive. So medicine is not like you learn a fact. You have to understand the concept of pressures. Then only you can understand the graphs, and only after graphs are understood you can understand the findings of any investigation. Flow volume curves, spirometry, plethysmography, etc. So therefore medicine is not you can learn at one place. You have to learn everything: physio, patho, pharma, biochemistry, bit of micro. That's the case. Okay. So now we'll discuss one more thing. Okay. The mechanism of respiration, या mechanics of breathing. So I hope you all are understanding everything. So mechanics of breathing. Okay. So first understand inspiration. So inspiration is a very important process. Why? Because if you don't inspire, you will expire. I know it's an old joke. So inspiration. Okay. So answer is inspiration. Okay. So it is what process? It's an active process. Why active? Anything which use energy is called as active. Why? Need energy for muscle contraction. Okay. So need energy for muscle contraction. Okay. So what does active means? Energy. So anything which use energy is called as what? Active. So obviously muscle use energy. So that's why need food. Why? The muscles cannot work without energy. And this contraction is done by two muscles: diaphragm and external intercostal. Okay, so diaphragm and external intercostal. Okay, diaphragm and external. Okay, diaphragm cause 75%. Diaphragm cause 75%. Okay, okay, clear? So 75% are diaphragm, 75%, and 25 are external intercostal muscle. Okay, remember intercostal are between the ribs. So what does intercostal means? Between the ribs. Okay, intercostal means between rib, costal is ribs. Okay, so now who's the main muscle? Diaphragm. So who's the main muscle? Diaphragm. Who's the main muscle? Diaphragm. And diaphragm is supplied by which nerve? It's supplied by phrenic nerve. Okay, coming from what? C3, 4, 5. Which nerve come and supply? Phrenic nerve. So now that is why any fracture of the cervical spine, especially at the level of C1, C2, C3, are very dangerous. They can kill you. So that's why they can cause diaphragmatic paralysis. So fractures, which one? Cervical fractures or phrenic nerve injury, they can cause death. Okay, can be lethal. They cause diaphragmatic paralysis. So remember, you can die from diaphragmatic paralysis. Okay, so what you can die from? You can die from diaphragm. Okay, die from diaphragm, die from diaphragm. Okay, remember that. Okay, okay. Now what do? I told you just now, these muscles basically expand thorax and decrease pressure. So they expand the thorax and they decrease the pressure. Okay, how? Let's see. This is the thorax, this is the diaphragm. So diaphragm goes down. So diaphragm descend downwards. Okay, so always remember, diaphragm goes down. So diaphragm descend downward. That increase the vertical diameter of thorax. So increase vertical diameter. So that's why it become a longer cavity. Understood? So it become a longer cavity. Okay, height wise. Okay, so that is the case. Okay, fine. Then also the intercostal muscle do their magic and they expand the thorax outwards and forwards. I cannot show this arrow. You got the idea? This like this. And the decrease pressure occur. So what they do is external. Okay, they will expand thorax forwards and outwards. Okay, so let me explain for you people. Understand? See, look at my thorax. Okay, okay, so can you see? So when I inspire, see, when I inspire, my chest move forward. See, so it come forward, so it will come forward. Okay, so it will move forward. Okay, clear? And it also goes outward like this. So that's why it's moving outwards and forward. So it's going outwards and forward. So that is why it is moving in forward direction and outward direction both. Okay, so forward, outwards. Okay, clear? And diaphragm is going down, so that means there is a expansion in all three direction, forwards, downwards and laterally, that is outwards. So that's why the size of my thorax will increase, and that is the funda you will see or have in this case. Are you clear? Okay, so how to remember this? Use my technique. So my technique is external expand thorax. So remember it always, external expand thorax, external expand the thorax. Okay, so EXT, external expand the thorax. Are you clear? So external expand the thorax. Okay, so I hope everything is perfectly clear to you. Okay, done. Okay, Now we will see the reverse, that is inspiration. Okay, inspiration is over, sorry. And what are the accessory muscles? They help in extra breathing. Okay, extra effort, they put extra effort. So they're not used in normal, they are for extra effort. Okay, so what they are sternocleidomastoid, sternocleidomastoid. So this muscle is attached to sternum, then clavicle, cleido and mastoid. So that's why called sternocleidomastoid. And what does it? Does the favorite movement of Indians. What is that? Do you know this? Will you do this? Like you ask NB, will you help us? You ask NCI, will you help us? You other students, will you support us? So that's why it causes turning of neck. So which muscle causes turning? Sternocleido, because it attached like this, na. So when it contracts, it will pull the neck on this side or other. So that's why it help in what? Turning of the neck. And also it can help lifting the thorax. So help in, yes, this. Okay. Then sklenic muscle. Okay, etc. Okay. Now we see expiration. Okay. Now we see expiration. Expiration. Okay. Clear? So yes, expiration. Okay. Now expiration is of two types. One is normal and other is forceful. Okay. So normal and forceful. Okay. Now what do you mean by term normal and forceful? Okay. Normal is what we do. So normal is passive. Normal is passive. Okay. So what do you mean by passive? There is no muscle use. No muscle used. Just elastic recoil of lungs. I'll discuss it. I've already discussed now. So lungs recoil. So just elastic recoil of lungs. Okay. Fine. Whereas forceful expiration, example, what? Coughing, sneezing, shouting. Okay. So all this, even Valsalva, all these are forceful. So in forceful, what happened? Like the अबे कौन, like you're shouting ना, क्या लेके रहेंगे आज़ादी, है ना, और MCA वालों सुधर जाओ, है ना, ठीक है, या फिर जो भी. So we are shouting to take our rights. So when you shout, you're using forceful expiration. So forceful expiration, and we'll need it when we have to go for protest. Okay. So when do you also I can write for protest. Okay. So we'll need, okay, protest. Okay. Fine. So in protest, what do we use? Forceful expiration. Okay. Valsalva is a forceful expiration against closed airway, glottis. Okay. So it's Valsalva, it's forceful expiration. Okay. Fine. Clear? You must have done a close the nose and mouth and forcefully breathe. You can see popping of this tympanic membrane, that is called as Valsalva. Okay. It is a test for checking patency of eustachian tube. Okay. Chalo. All good? Okay. Fine. Okay. Now forceful is passive active. It's an active process. Active process. Okay. Use muscles. Use muscles. Which ones? So please write down. They are abdominal muscles. I'll just write abdominal and internal intercostal. Now what they do is they do reverse. Okay. They basically, yes, they basically compress and reduce size of thoracic cavity. Okay. Reduce the size of what thing? Thoracic cavity. So they will reduce the size of what? Thoracic cavity. Okay. Okay. Clear? Now if there is a reduced size of thoracic cavity, it causes what? Increased pressure, which I discussed already. Increased pressure. How? Let me show. This is abdominal muscles. So these abdominal muscles will push diaphragm up. push diaphragm up. Okay, so they will push diaphragm in what direction? Upward direction. Okay, so that's why they will again reduce the size, and internal will, yes, make the thorax go inwards and backwards. So again it will, yes, inwards and just say inward movement of thorax. Okay, so remember, internal, inwards, internal, inwards. So remember, you will never forget, external are outside, so they expand. External expand, internal are inner, so they will compress. So internal compress, external expand. Very commonly asked question. External expand thorax, internal ingress, inward movement of thorax. So what increase the pressure? Internal. What decrease the pressure? External will decrease the pressure. Easy, no trouble at all. Okay, so that is internal and external doing their actions. Are you clear? Okay, done. Okay, fine. Okay, so everything is clear here. Chalo. So everything is perfect. Yes. Okay. Chalo. Okay, so done. Let's move further and we'll see something very, very important. Okay, that is intrathoracic pressure. So please understand and you will have everything perfectly clear. Okay, chalo. So everything is going fine. Everyone is solving the questions also. Very good. Okay, so questions were there like bone resorption is caused by. So obviously which hormone cause the bone resorption? Okay, so I think let's do some questions. Okay, then we'll move further. Okay, better. So what I'm going to do is we'll do some questions. Okay, so where are our questions? Yeah, here are the questions. Okay, so I'll be doing this. Okay, and I will keep asking questions. So question, parathyroid hormone effects are all except. Okay, so let's do these questions. Okay, clear? So all of you participate. Okay, so all are actions of the parathyroid hormone. Okay, except increase bone resorption. Yes or no? Yes or no? Let's solve this question. What is the answer? Very good. Okay, very good. Okay, all of you have to solve the questions also. Okay, otherwise there's no use just studying. We have to, yes, solve the questions also. Okay, okay, so answers are coming. Very good. Okay, so let's solve easily. See, increase bone, yes. How? Via osteoclast. Then increase calcium, yes. Very good. How? Via vitamin D. Okay. Increase phosphate, no, 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 no. It rather cause phosphate loss in urine. Phosphate is lost, not reabsorbed. Wrong. Increase vitamin D3, yes. How? By hydroxylation. So answer is what? It is C. Very good. Okay. See some image questions also. Bone resorption is caused by, okay. So question, same question came. Okay. So question is, bone resorption is caused by which cells? Blast or clast? Blast or clast? Yes, it is osteoclast. Okay. One tricky question for you. Osteoclasts are formed from which cell? So they are derived from which cell? बताओ, जो क्वेश्चन देगा उसको चॉकलेट. ओके, कहाँ है ये रही. The one who give the answer will get the sneakers. Okay. So question is, yes, osteoclasts are causing the bone resorption. They cut the bone. Question is, what are they derived from? Very good. Okay. Class cut the bone. Okay. Where are the class derived from? Which cell they are derived from? Anyone? Chocolate question. Chocolate, chocolate, chocolate. Yes, it is B, obviously. Macrophage, very good. Monocyte, very good. Okay, again, it's a bit tricky question. Yes, what answer is right? Okay, yes, the answer is monocytes. Monocyte, when they enter the tissue, they are called as macrophages. So technically both are right, monocyte. So Siba Sahu, and who gave the answer? Macrophages, and Akash, both gave right, is monocytes. So monocytes get transformed into osteoclasts. Very good. Okay, okay. Other question also, let's see. Okay, हाँ, ये question था. Which organ is least involved in calcium homeostasis? So which organ is least involved in calcium homeostasis? करो भाई solve. Yes, monocyte. Okay. Samraj, very good. Harindra, very good. Yes, Pratibha. Yes. ठीक है अनामिका. Yes, it's hemopoietic cells which give rise to what? There are two, myeloid and erythroid. So the myeloid give this which ones? Yes, the monocytes. Okay, clear? चलो. Okay, see kidney, they make vitamin D, so they are involved. Okay, and also they absorb calcium. Skin make vitamin D, so involved. Intestine absorb calcium. लंग्स, घंटा तुम कुछ करते हो, तुम सिर्फ एयर लाते हो, कैल्शियम नहीं. अब बोलना सर एयर में से कैल्शियम निकाल लो, अब ऐसा ना होता है. ठीक है, सो कैल्शियम इज नॉट देयर वाया लंग एंड इट डजंट मेक अ हार्मोन. हाँ, लंग्स प्ले रोल इन एस प्ले रोल इन अल्डोस्टेरोन. सो अल्डोस्टेरोन कैन बी देयर, सोडियम, बट नॉट कैल्शियम. सो आंसर इज लंग्स. ओके, सो लंग्स इज आंसर. वेरी गुड. ओके, so you all are doing very well. Okay, and I'm very hopeful that 31st August you have passed already, and those who are giving December, yes, this question. Okay, so what is this image showing? Okay, what is this image showing? Okay, which sign is this? Name. Yes, lung is answer. What is the sign we are seeing here? Name of sign. Yes, very good. Okay. Yes, caustics. Okay, very good. Okay, yes, it is the, okay. So what is the answer? Caustic sign. See, one more thing is, see, 590 people saw and 556 answered. I want maximum people to answer. It is for your learning only. It is not for me. Okay. So what is this X-ray showing? This X-ray. What do you see? Findings and the disease name. Findings and disease name. Findings and disease name. Findings and disease name. You can see what widening. Yes, epiphyses have widened, very good. And there is cupping, there is a cupping defect, and the which effect? Yes, and the fraying. Okay, fray. Yes, it is rickets, very good. So we are seeing cupping, we are seeing fraying, and we are seeing epiphyseal widening. Okay, very good. Okay, fraying and cupping, very good. Okay, so what is the diagnosis? It is rickets. See, 57% people got this right. Okay, so I want everyone to solve and get this question bang on target, because that is what the idea is. The learning should be complete. I hope it's clear. Okay, so let's come to our topic. Okay, now we'll do something very, very important, and I want your full support in that. Okay, clear? Okay, now we'll discuss the pressure outside the lungs, there's a lung and there's a cavity outside the lung. Okay, so this is the case. Okay, very good. Okay, done. Okay, now first question is, this is your pulmonary cavity, this is a pulmonary cavity, and the pressure is IAP. Now there is just outside the lung a double layered cavity with two layers. One layer, this one, I'm using a color which is slightly this one. This is attached here to the surface. Can you see? So this is called as the visceral pleura. So this is visceral pleura attached to lungs. It is attached to lungs. Attached to lungs. Okay. On the other hand, we have another layer. I'll use slight color change and then try to highlight this one. Attached to chest wall. This is the other layer. This is parietal pleura. Attached to chest wall. Attached to chest wall. So there are technically two layers, and the cavity between the two layers, this cavity is called as a pleural cavity. So where is pleural cavity present? It is between the two layers of pleura, the visceral and the parietal pleura. Okay. Now, unlike the pulmonary cavity which is connected to the atmosphere, it is a closed cavity. It is a closed cavity, as two layers of pleura merge at hilum. Okay, so they are going to merge at the hilum. So imagine this is pleura. Okay, so one layer you attach to the lungs, and then you keep folding and other layer you attach to chest wall. So what happen? You have a cavity between the two layers and this cavity seal at the hilum. So therefore you have a cavity, but this cavity is a closed one. It doesn't have a opening or exit. It's a closed cavity. This is called as pleural cavity. Okay. So which is the cavities we are having? Two cavity, pulmonary and pleural. Pulmonary is connected to atmosphere. Pleural is connected to nowhere. Are you clear now? Pleural. Okay. Now pleural cavity is a closed cavity. Open cavity, the pressure is same as outside, but closed cavity is not connected to any place. So that's why its pressure is not always equal to 0. It can be more also, less also. So write down one more thing. Okay. Closed cavities example gas cylinder. Example gas cylinder can have any pressure, can have any pressure, positive or negative. Okay, so they can be positive also or they could be negative also. So positive also and negative also. Okay, so positive also and negative also. Okay, so positive pressure also and negative pressure as well. So positive also, negative also. Okay, clear? Like gas cylinder is positive plus 100 psi, so it's 1000 psi. Okay, points per square inch, or it could be 2000, 3000, and negative in a vacuum. So therefore closed cavities can have any pressure, plus also, minus also. Okay, hence pleural cavity always has negative pressure at rest, called as intrapleural or intrathoracic pressure, ITP. Okay, so which pressure? It is ITP. That is ITP, intrathoracic pressure. Okay, ITP. Okay, so I hope it's clear. So is it clear now? So clear? Okay. So what is ITP? It is always negative. MCQ. Okay. So it's again a very important topic. Why? Again, इस नेगेटिव प्रेशर से जो क्लिनिकल क्वेश्चन बनता है वो तभी सॉल्व होगा जब आपको पता हो नेगेटिव प्रेशर क्या चीज है. ओके, सो व्हाई इट इज नेगेटिव? आंसर इज इट्स अ क्लोज कैविटी. ओके, नाउ व्हाट इज द वैल्यू ऑफ दिस? राइट डाउन. sorry. So ITP at rest is equal to minus 2 mmHg or minus 3 centimeter H2O. Now what is this? Let me explain. First, 1 mmHg is equal to 1.36 centimeter H2O. Okay, so 1 mmHg is equal to 1.36 centimeter of H2O. Okay, of H2O. Okay, so 1.36 centimeter. Okay, so you want to convert, you can just convert 2 into 1.3, roughly 2 point something, so that's like roughly 3. So it's asked in the 2018 FMG exam. Factual points still can be asked, so I'm discussing it to you. Okay, so the pressure it is always and always negative, always and always negative. Now what is the importance of negative pressure? So remember, positive push. So remember, positive pressure push, negative pressure pull. So positive pressure push, negative pressure pull. Positive pressure push, negative pressure pull. Now what is the implication? Let me explain. Okay. This is a lung. Okay. And this is a pleural cavity. Okay. And this is the ITP, minus 2 ITP. Okay. Now what is this negative ITP trying to do? It is trying to pull lungs towards them, that is thorax. So this negative ITP, so negative ITP will pull lungs outward towards thorax. Okay, so they are trying to pull them outward. On the other hand, the negative pressure will pull them out and positive will push. Okay, now what happens is the tendency of any rubber band or anything is to recoil inward. So where will it go? Always trying to go inward. Okay, like example, rubber band, you stretch, but when you leave, it will always recoil inward. So lung is like a rubber band, it always try to recoil inward direction. Inward direction. So this is inward. Inward recoil. Okay. So it is inward recoil. Are you clear? Okay. So, right, the tendency of lungs is to recoil inwards and collapse. Easy. So lungs want to recoil and collapse. Okay, and what is the negative pressure doing? Pulling them out. So that means lungs are trying to collapse, negative trying to expand them. So what happens? They reach a equilibrium where, what happens? Let's say this thing. Okay, so I am trying to pull it this way, this side. So what happens? At equilibrium, it is neither going this side or this side. So lungs will neither collapse or not, they will expand and burst. Why? Because of equilibrium. So what happens? But it is prevented by negative ITP at rest. So what is preventing the collapse? Negative ITP at rest. So please mark this in highlighted thing and recall and remember it thousands of times, that what is preventing collapse of lung in a healthy person? Answer is negative ITP. Answer is negative ITP. I hope it's clear. What are the hypothesis? So let me prove. Let's say during a fight, a person stabbed the other on the chest. This is a stab wound. Okay, so let's say there's a stab wound, stab or puncture the chest wall. So now there is an opening, and now it become what? Open cavity. Open cavity. What thing? Thorax. So now thorax is open cavity. So now air will go to lung or thorax? Yes. So air enter thorax. Air enter thorax. Why? Because of opening. And if air enter, the pressure will remain negative or become equal to atmosphere. So air enter and ITP is equal to 0. Why? Because there is no difference. So now the ITP is equal to 0. I hope is clear. Is equal to 0. And once the ITP become equal to 0, there is no two forces, only one force. And what is the only one force? That is the inward recoil. So now what happens is there is unopposed inward recoil. Inward recoil. So unopposed inward recoil will collapse the lung. will collapse the lung. See this diagram? So what you can see it, if you pay attention, that the lung is collapsed. And what is the reason for this collapse? It is collapse. The reason is what? There is only inward recoil which make the balloon collapse. So take a balloon, fill air and leave. What happens? Immediately the balloon will collapse. Why? Because there is no force holding it in. So it will collapse. But if you tie a knot, the balloon will not collapse. So that same thing is done by negative ITP. So lung will collapse. The lung will collapse. And this condition is called as what? This is called as. So it's a open or closed cavity? Open cavity, so open. Pneumothorax. So it's called as what? Open pneumo. So why it's open? Because it's a open cavity, so open. What does pneumo means? Pneumo means air. So where is the air now going? Pneumo means air. So air is now going where? In the lungs, so thorax is going in the thorax. So that's why called as open pneumothorax. Okay. And if you remember, there were two questions from this topic. That is, what is the management for a patient without any sign symptom with small pneumothorax during the surgery? Okay, I think some hiatal hernia surgery. Okay. And second question was about the air fluid level in hydropneumothorax. Are you clear? So was there a question of hydropneumothorax? So what I'll do is, I will show you the graphs, X-ray of both, that there is basically air fluid level. That's the hallmark, air fluid level. Okay, like example, look at this bottle. Can you see a very clear cut line? This is the fluid level. So whenever there is a fluid, you'll always get a very straight line, not a curved line, but always a straight. That is air fluid level. Okay. So what I'll do is, I'll show these graphs after break. So we'll take a break now. Okay. So we'll take a 20 minutes break. Okay. So we'll meet and I'll show you both the question answers. Open pneumothorax, hard pneumothorax, how you differentiate, what are the best investigation for pleural effusion, etc. Okay. So we'll do it after the break. So just give me 20 minutes. Okay. Fine. So I hope you are all learning and we are solving all the clinical question asked in the exam with your physiology classes simultaneously. Okay. Chalo.